Welcome to The Explainer. Today, we're going to break down the incredible story of how science has completely turned the tide against advanced kidney cancer. It's a journey that really takes us from what was once a near-certain death sentence to the absolute cutting edge of medicine. So let's start with a pretty sobering number. Not that long ago, this was the 5-year survival rate for somebody diagnosed with kidney cancer that had already spread. Yeah, a really stark reminder of just how tough this disease has been to beat.
The disease we're talking about is called renal cell carcinoma, or RCC for short. And for about a third of the people who get it, by the time they're even diagnosed, the cancer has already metastasized, it's already spread. And historically, once that happened, the disease was almost always fatal.
So how did we get from there to here? Well, that's what this is all about. It's a story of incredible scientific progress, a journey of discovery that's unfolded over decades, with each breakthrough building on the last one to completely rewrite what's possible for patients. Okay, so let's dive into the first era of treatment. This was a time when the toolbox for doctors was, well, pretty small. But the strategic questions they were asking back then were absolutely foundational for everything that was going to come next. So right at the beginning, doctors had this huge question they had to answer. If a patient's cancer had already spread around the body, did it even make sense to do a major operation to remove the original tumor in the kidney before starting them on drug therapy? And you know what? Landmark clinical trials gave a crystal clear answer, which this graph shows perfectly. The results were just unambiguous. Patients who had the surgery to get that main tumor out before starting therapy, they lived longer, period. Now you might be thinking, 3 months? That doesn't sound like a lot. But you have to put yourself back in that time. Back then, this was absolutely monumental. It proved that a combined strategic approach could actually work, and it set a brand new standard of care. So what was this therapy they were using? Well, it was something called cytokine therapy, and honestly, it was kind of a blunt instrument. It was a first try at boosting the body's own immune system to fight the cancer, but the response rates were really low, and long-term success was incredibly rare. It helped a few people, for sure, but scientists knew there had to be a smarter way to do this.
Okay, that brings us to the next chapter. And this part of the story, wow, it starts with a single genetic discovery that just changed everything.
So get this. Scientists discovered that the vast majority of these clear cell kidney cancers, that's the most common kind, have a defect in one specific gene, the VHL gene. And this gene acts like a master switch that, when it's broken, basically tells the cancer to just grow like crazy.
And this is where it gets really clever. This faulty gene kicks off a chain reaction that ultimately sends out these signals telling the body, hey, build more blood vessels right here, a lifeline to feed the tumor. So researchers asked a brilliant question. What if we could block those signals and basically starve the cancer by cutting off its blood supply?
And the results, they were absolutely dramatic. The very first of these new targeted therapies, a drug called sunitinib, more than doubled the time that patients lived without their cancer growing. This wasn't a small step, this was a massive leap forward. And you can see that impact right here. That top line, that's the patients on the new drug, sunitinib. The bottom one is the old standard. That huge gap between them, well, that represents a whole new era of hope for patients. For years, this graph was the picture of success in kidney cancer care. But you know how science works. Progress never stops. The next great leap forward came from looking at the problem in a completely different way, shifting the focus from the tumor itself back to the patient's own immune system. So the thinking went, instead of just starving the tumor, what if we could teach the body's own powerful immune system to recognize it and destroy it? That's the revolutionary idea behind immune checkpoint inhibitors. They don't attack the cancer themselves. No, they do something much smarter. They take the brakes off our own T cells, unleashing them to hunt down and kill cancer cells. Okay, so this is the crucial comparison. The graph on the left, that's the big step forward it made that we just talked about. But now, look at the graph on the right. This shows a combination of 2 of these new immunotherapies going head-to-head against sunitinib. That massive separation between those curves, that's another revolutionary leap. And this brings us to maybe one of the most exciting statistics in this entire story. The conversation was no longer just about slowing the cancer down. For the very first time, a significant number of patients, we're talking 9 times as many in this trial, were seeing their metastatic cancer completely disappear, vanish, a complete response. This was an absolute game changer.
And this, of course, led to the powerhouse strategy that defines treatment today, combination therapy. The idea is brilliant, right? You hit the cancer from multiple angles at once. Use a targeted drug to help starve it, and you use an immunotherapy to unleash the immune system on it.
And it wasn't a one-off. Trial after trial confirmed this approach was superior. This graph here from another huge study shows yet another powerful combination just crushing the old standard, sunitinib. And that's what cemented combination therapy as the standard of care for most newly diagnosed patients.
So when you step back and you look at this whole journey, you realize it's not just a story about drugs. It's a story about the incredible, accelerating power of scientific progress itself.
I mean, just look at this timeline. We've gone from the blunt instruments of the cytokine era in the 90s to today's combination era. In just a couple of decades, we went from hoping to buy a few months to actually seeing complete responses where the cancer is gone. The pace of this change is just astonishing.
So the key takeaway here is really how each era built upon the last. First, cracking the code of that VHL gene led to precision drugs. Then, learning how to unleash the immune system gave us checkpoint inhibitors. And today, combining these two powerful strategies is giving patients their best chance yet, a shot at long-term survival that was just unthinkable not that long ago.
And this leaves us with a truly hopeful final thought. The progress has been so rapid, it forces us to ask a whole new question. Are we moving from an era where this disease was a death sentence to one where it can be treated as a manageable chronic condition? The science suggests that future is closer than ever.